Hello, I'm Dr. Desiree Dawson. I am a cardiologist, and we are in February, which is American Heart Month. We are going red for women. Okay, so let's talk a little bit about what cardiovascular disease is. What it really is the number one killer among women, and we need to be aware of what that means, what encompasses cardiovascular disease. We're talking about hardening of the arteries, blood pressure, diabetes if you're diabetic, cholesterol levels, and everything else as far as risk factors that goes along with that, including exercising, eating right, those types of things. Family history plays a role with your numbers. When we talk about cardiovascular disease being the number one killer in women, it's because of not being aware of the warning signs and women getting checked out regularly. We as women, we're on top of our game. We try to be, because we try to handle so many things on a day-to-day. Job, work-related businesses, family. We get stressed and care for others when we're not really caring for ourselves. You have to make sure you take care of yourself. We want our women to be around as long as possible. So let's talk about warning signs for heart attack. For women, it's not as classic as you see in men. You have the classic symptoms of crushing chest pain and nausea, vomiting, and pain going down your arm. You do have that. Women do experience that as well, but there are times when women don't experience those classic symptoms. It could be an upper back pain, chest pain that shoots to your back, chest pain that, can go up your neck, but, can also go to your stomach. Maybe you're just shortness of breath and didn't think much of it. And I've seen patients, women especially, come in a couple days after a heart attack, and now you have heart damage. So let's talk about warning signs and when to get checked out, right? If you feel a different symptom, it's new, you don't feel right, it doesn't hurt to get checked out by a primary care physician. Ask a family member, go to the emergency room if it's severe. Just get checked out. And I'm not talking about women just in their 60s, 70s, and older. I'm talking even to my women in the 30s, 20s even. If you have a family history, you definitely want to get checked out even earlier. If you're diabetic, you got to get checked out even earlier. So know your numbers. When it comes to blood pressure, if it runs in your family, if you tend to eat out a lot, you've never had your blood pressure checked, get it checked. Know those numbers. Cholesterol, if you tend to eat things that are fatty, fast food, and you're always eating fried, get your numbers checked. The American Heart Association talks about the essential 8, and that encompasses a lot. And if you have those in check, you're really living toward a healthier lifestyle. Those things include cholesterol, sleeping better, getting good night's sleep, weight management, and exercise, knowing your cholesterol levels, quitting smoking. You got to do these things. Your blood sugar's got to be in check. These are things you really got to keep a hold of and handle of when it comes to live a healthier lifestyle. Eating better. Watch what you're putting in your body. More of the nutrient-filled foods, less fatty foods, more vegetables, more, it could be protein shakes or so. More protein meats that are baked, stewed, not fried. Staying away from bread and sugar, added sugar, pastries, things that are just not filled with nutrients. We've got to do better with what we're eating. When it comes to exercise, you don't have to go to the gym. You can exercise outside your home. You can exercise in your home. But we say at least 30 minutes daily, 5 days a week, or 3 days a week for an hour. Moderate exercise. Could be cardio, could be weight resistance, any kind of resistance training. You could go for a dance class. But let's keep a routine going. We got to be disciplined in what we're doing day to day. Another cardiovascular disease is not just heart attacks, it's strokes. What are those warning signs? Slurred speech, can't move your arm, can't move a limb, tingling, numbness, drooping of the lips. Those are stroke-like symptoms, and that is an emergency. Call 911. But be aware. I don't want my women to be afraid to reach out. You're never too young to reach out. Just get your numbers checked. Get your labs drawn. Reach out to a primary care family physician. Get checked out. Even your OBGYN doctor, if you're concerned, can check labs for you. Check your blood pressure. And if it's high, see a primary care physician and know to get your blood pressure in a better range. Okay? So, all in all, let's all live healthy. This is American Heart Month, and we are women, and we want to live longer, healthier lives. So Let's keep our heart in check, guys, and let's do the right thing. Again, I'm Dr. Desiree Dawson, cardiologist, and happy to give any more information